much, everyone, for staying with us. Now, let's look at some of the promises made by President Bola Tinubu, especially in key areas like education, health, employment, and all that. But attention tonight is about on the issues of health. And what about health? Is also the insurance of it, providing quality healthcare for Nigerians. Part of the promise that are being made is that not only that Nigerians will get quality healthcare, is also the fact that the Bola Tinubu government has promised that they will take millions of Nigerians out of health poverty. What is health poverty? Tonight, let's turn our attention to speaking with the Director General and the CEO of the National Health Insurance Authority, Dr. Kelechi Ohiri, who joins us live from our Lagos studio. Thank you so much, Doc, for joining us tonight. Give us an understanding. When this government says taking millions out of health poverty, what does that mean?
Well, thank you very much for the question. So, health poverty, from the way it can be defined, is twofold. First, we look at the fact that most of those who are poor cannot afford healthcare, because a lot of healthcare in Nigeria is paid for out of pocket. About 70% of health expenditure in Nigeria is out of pocket. But there's another dimension to that. And that dimension is the fact that there are those who can afford to pay, but when you're hit with a particular illness that makes you incur catastrophic costs, you're so fragile that that could actually put you back into poverty. So in order to lift Nigerians out of health poverty, we're saying two things. One, we're going to support the poor so that they can afford good quality healthcare. And then secondly, we're going to create a form of financial protection through insurance so that those who can either pay the premium or those who can actually afford some basic healthcare can actually afford that and pay into a pooled mechanism that will prevent them from bearing the catastrophic costs of healthcare should you have an incident or an episode that requires significant health expenditure. So by expanding coverage, insurance coverage to many, you are lifting them out of health poverty, but you're also reducing their level of vulnerability to poverty that results from healthcare expenditure.
So let's get this straight. There are those who will say that how can you insure or give people health insurance when the health facilities and the infrastructures are not even in place in the first place? What do you want to insure when they cannot, they don't have the facility? Doctors are getting out of the country in droves. I mean, it looks like building something or nothing. It does look. So what are you insuring when the infrastructure is not even there in the first place?
So no doubt there are challenges. And when you look at a health system, you look at things on both the demand side, which is what do you do to generate appropriate demand for healthcare? And you also look at things on the supply side, where we're looking at the availability and accessibility to basic healthcare. And you have to approach those two things. Now, my colleagues in agencies like the National Primary Healthcare Development Agency are working on some of the things called supply side care through refurbishing primary healthcare centers, making sure they have the requisite human resources, drugs, and commodities so that when you get to those facilities, you can get basic healthcare. And a lot of work has been done on that. And I'm sure in some instances, we'll have the opportunity to delve in that. But the issue we're trying to address through the National Health Insurance Agency is this. Even when people go to those places where care is being provided, can they afford it? And what can we do to make that care financially accessible? And that's where we come in, which is using insurance as a mechanism to ensure financial protection so that you don't have to pay out of pocket when you are ill or when you actually need the care. And this is not a mechanism that is new to Nigeria. But in fact, by doing so and creating that predictability of financing for healthcare, it actually spurs more people to invest in service delivery. So it's the other part of the equation that needs to be addressed in order for us to have universal healthcare coverage as we go along.
getting health is part of the rights of a citizen. But the question is, for an average Nigerian citizen, millions, over 130 million of them who are living in multidimensional poverty, health is one of those indices captured into the measurement of that figure, of that number. But the question is, how can the average person know what to do, how to go about it? You are saying that if an average Nigerian citizen is sick, what your plan is, or the Tinubu government's plan, is to ensure that they don't have to pay from their pocket immediately when they are ill. They would have to pay forward. Or how do they go about it? A lot of education needs to be done. What is the first step?
Absolutely. You've hit the nail on the head. There's a need for more awareness of the programs that are available. And we're not starting from scratch. In 2022, the NHIA Act was passed, and this was building from the National Health Act that was passed in 2014. And that created what is called the Basic Healthcare Provision Fund, for instance, where 1% of the consolidated revenue is earmarked to support primary health care, because most of the conditions for which people seek care are primary health care issues. Now, half of that goes into a pathway called the NHIA pathway to cover health insurance targeted at the poor. And about roughly half of that also goes into creating service readiness at the primary healthcare facilities across the country. So the NPHCDA works with the state primary healthcare development agencies to ensure that the primary healthcare services are service ready by upgrading them to provide that complement of human resources, especially at the community level that goes down to the community. One of the tasks they perform is the outreach and sensitization and education and promotion in the communities to enable people realize that for the conditions that they suffer, that you could actually access healthcare for that. On the other hand, we've also realized that one of the barriers, even when people know that services are available, they don't avail themselves of it. Part of it is because of the financial barriers to access. And when they are enrolled in the Basic Healthcare Provision Fund, for instance, working together with our state counterparts, then an education comes with that enrollment so that you can go to a facility, a primary healthcare center, or any of the accredited facilities, if it's the private sector, and actually access healthcare and not have to pay. And that information and knowledge is critical. So that awareness needs to be created so that people understand what is available. And that's one of the things that we've been working together with our state counterparts to actually accomplish.
So let's, Dr. Oyiri, let's get it clear, because my viewers tonight will be wondering, give us practical, implementable actions for the average Nigerian citizen. What kind of ailment for an average Nigerian citizen? You are sitting in Lagos right now. For someone who perhaps may not be able to afford 5,000 naira for healthcare, for example, is there any class of ailment and any kind of health care facility in Lagos, for example, in any location that you can point at that they can go to tonight and get payment and get treated or get health care attention?
So thank you for the question, and let's unpack it a bit. There are ailments that lend themselves to primary health care, which means that if your child, for instance, needs to get immunized for a condition, you can walk into any of the primary healthcare centers in Lagos and you can get immunization based on the schedule. Every state has certain policies for primary healthcare where at the point of provision of primary healthcare, you get basic services. Nigeria has a mixed healthcare system, and the problem we're trying to solve is that such that if you go to a particular facility, for instance, a private facility, where they need to recover their costs, they charge a user fee. And when you go there, it means that those who do not have the pocket cannot afford it. And that is what we are trying to cover, to say, get access to health insurance, because that provides that financial protection, so that when you go to that facility, that either your HMO or the state health insurance authority has accredited to provide those services. And when you are enrolled, you will be assigned to your particular facility that you would have chosen, and therein you would get care that's provided that you don't have to pay out.
So Dr. Kelechi, hold on a minute. So I'll give a practical example, and I want you to guide us through how the Tinubu government hopes that this can work, for example. So give us an understanding. I am Sheun, and I'm a carpenter. I work for myself. I don't have as much to spend on health. But I'm hearing tonight, I'm listening to you tonight, saying that I can enroll for a health insurance that will allow me get treatment even when I do not have money because I've paid for it. So the question is, give me an idea. Let's assume that I live in Ogba area of Lagos. Where can I get enrolled? What is the minimum that I can pay? How much do I pay every month? Give us an understanding in that scenario that I've just given now.
Okay, thank you. So, Sheun, if you were enrolled with a health insurance agency, now you have options.
Where would I find one? Let's assume I don't know. Where would I find one?
In Lagos, for instance, there are several. So let's start with the public provider of health insurance. So the Lagos State Contributory Health Management Authority is one that you can enroll with. But in Lagos, you have the good fortune of having lots of private sector providers, HMOs, that you can actually enroll with through different programs. Now, once you are enrolled, there's a lot of information that is provided to you that if you lived in Ogba, you would know which hospitals and which facilities the HMO has already vetted and already has a relationship with that you will be directed to. And once you are enrolled, you'll probably receive a card that once you go there, you provide your number, care will be provided to you. They will verify that you are who you say you are. They will verify the coverage with the HMO or with the state, and then they'll provide the care that you need to have. Now, it's also important to mention that there are multiple schemes that are targeted to different segments of the population. For those who are currently employed, and one of the things about the Act was that it made it mandatory, although we're still in the process of evolving to enforce that. But what it means is that either the public option in the state or the private option, you will have a selection of hospitals or facilities for which you can access care. Personally, I have benefited from this in the past, and I'm sure you can also benefit from that if you get insured. Now, let me also clarify one thing that, one of the things that we have had in Nigeria, the coverage is still quite low. And right now, roughly about 15 million Nigerians have health insurance. That is just roughly 7% of the population. So we have a long road ahead. But we're not starting from scratch. There have been interventions that have been put in place to set us on that path. And it's a long journey ahead, but it's one that I believe that with the policies
within the next, sorry, doctor, if I may come in. Yeah, within the next 1 year, if you have about 50 million on enrollment, what is the number that you're targeting within the next 1 year?
I do not want to speculate and give any random arbitrary figures because it's based on understanding a lot of detail. One is conducting proper actuarial analysis to ensure that the premiums that are being charged, the benefit package is robust enough, etc., to know what, given the fiscal space here, we can actually get to. But we do have significant aspirations to actually go very fast. I'm looking at certain opportunities that we have. For instance, we have the Basic Healthcare Provision Fund that is geared towards ensuring that the poor and the vulnerable are covered. There's a vulnerable group fund because there's an equity mandate involved. And so it's important to ensure that we look at how we optimize these pathways of financing to cover as many people, to target them appropriately, and then increase coverage. But I agree with you, we are not where we should be, and a lot needs to be done to get us there and get us there in a sustainable way and properly. And that's what we are trying to get to.
Dr. Ohiri, I'd like us to anchor on this point. And I'd like to let a lot of people know, as much as there are a lot of challenges within the healthcare sector in Nigeria, the good side is that there are a lot of people who are also looking to Nigeria, coming into the Nigeria, even from the UK, for health care attention here, and they are patronizing private hospitals here in Nigeria. It's good news for Nigeria. But where I'd like you to anchor tonight, perhaps in 30 seconds if you can deal, there is a lot of discrimination. There are a lot of people who are complaining about the NHIS scheme. And what are you doing immediately to checkmate some of the discrimination that is going on in our hospitals with this scheme? In 30 seconds, please, if you may.
Thank you. So, first of all, the NHI is taking such things very seriously through our enforcement team to make sure that, first of all, our insurance has to be patient and citizen-centered, which means that we will not tolerate any form of discrimination against any citizen based on the type of, or the profile that has been attributed to the person. And so, yes, if there are any such complaints, just let us in the NHIA know. We will definitely go through that. But be that as it may, one of the reasons for discrimination might be the perception that if it is person is covered by NHIA, somehow maybe the premium is not enough, or perhaps maybe it's a particular segment of the population. But it's our policy definitely to fight and to guard against any form of discrimination. And it is particularly so because these are people that are extremely vulnerable and they are coming to receive care at a moment of vulnerability. It is incumbent on us to make sure that that doesn't happen. And it's something that we take very seriously.
All right.
We're addressing and we'll fight.
Yeah, it's one of the promises that President Bola Tinubu made, and we are hoping that those promises are going to be kept. Education, health. In fact, he says that there will be an increase in the budget for health, and we're hoping that those who are poor will be able to access health. Thank you so much, Dr. Kelechi Ohiri, the DG and the CEO of the NHIA. Thank you so much indeed for your time tonight.
Thank you very much.
And that's how we anchor tonight on the program. And thanks for watching, everyone. I'm Sean Kimale. Bye-bye.